Bariatric surgery, stomach reduction surgeries, and gastrointestinal reconstruction procedures. Many of us have heard about them or know someone who has gone through one. You may have even seen patients in the pharmacy after surgery, dealing with complications and starting on vitamins or digestive support medications. So, what are the main types of these surgeries? What problems can happen after them? Who is actually eligible to undergo such procedures? And how does the doctor decide if surgery is necessary? We also need to ask an important question. After surgery, does a patient maintain a stable weight, or can weight regain happen over time? Another key point: what are the essential vitamins, minerals, and nutritional supplements that every patient must take after these operations? And what are the correct doses to prevent deficiencies? Today's episode covers all of these important questions in a clear and practical way. It's a detailed topic, but very important. Stay with me. Peace be upon you. I am Hussein Lotfi, and you are watching Octopus Pharmacist channel. Welcome to a new episode of From A to Z. At the beginning, here are the main topics of today's episode. If you want information about a specific point, you can go directly to the part of the video that starts with that title. But if you want to understand everything about bariatric surgery, including sleeve gastrectomy and gastric bypass operations, stay with me from the beginning until the end. As usual, let us first take a simple overview and understand the most important information related to bariatric surgery. The first point is, why are these operations important? Are they only done for cosmetic reasons or body shape? Keep in mind that bariatric surgery is not just about appearance. Obesity is strongly linked to many serious diseases that may reduce quality of life, and in some cases may even increase the risk of death. Excess weight is associated with high blood pressure, type 2 diabetes, high cholesterol, heart disease, sleep apnea, infertility problems, joint and bone disorders, fatty liver disease, and many other health complications. Because of this, many insurance companies in several countries now approve bariatric surgery for eligible patients. Why? Because treating obesity early may reduce long-term healthcare costs later, such as medications for diabetes, blood pressure, cholesterol, and complications affecting the heart, kidneys, and blood vessels. The second point is, who are the people qualified for sleeve gastrectomy or gastric bypass surgery? There's a very important measurement called BMI, which means body mass index. It is calculated by dividing a person's weight in kilograms by height in meters squared. For example, if a person weighs 100 kilograms and their height is 1.70 meters, we divide 100 by 1.70 by 1.70. BMI equals \frac weight, kg, height caret 2, m squared. If the BMI is 40 or higher, this is considered severe obesity, and the patient may become eligible for bariatric surgery. In some cases, surgery may also be considered when the BMI is between 35 and 40, especially if the patient already suffers from chronic diseases such as diabetes, high blood pressure, sleep apnea, or severe joint problems that are difficult to control with medications and lifestyle changes. In many patients, significant weight loss after surgery helps improve these diseases greatly, and sometimes some conditions may partially improve or even go into remission, especially type 2 diabetes. But if the BMI is below 30, surgery is usually not recommended except in very special medical situations decided by specialized doctors. In these cases, the patient should first focus on lifestyle modification, including healthy eating, exercise, behavioral changes, and medically supervised weight loss treatment. Some patients may also benefit from approved obesity medications. Now you may ask, what are the main types of bariatric surgery, and which operation is considered the best? Let us go through the most common operations one by one in a simple and organized way. The first type is sleeve gastrectomy. In this operation, around 70% to 80% of the stomach is removed, leaving a narrow tube-shaped stomach. This reduces the amount of food a person can eat and also decreases hunger hormones, such as ghrelin. Most patients may lose approximately 25% to 35% of their excess body weight within 1 year to 18 months, especially if they follow proper diet and exercise instructions. One of the common problems after surgery, especially in the early weeks, is nausea or vomiting after eating too quickly or eating more than the stomach can tolerate. Because the stomach becomes much smaller, patients must eat slowly, chew very well, and avoid large meals. Another important point is that, over time, the stomach can gradually stretch if the patient returns to unhealthy eating habits. This may contribute to weight regain years later. That is why long-term lifestyle change is the key to maintaining results. One advantage of sleeve gastrectomy is that the intestines are not bypassed, so nutrient absorption problems are usually less severe compared with gastric bypass operations. In addition, the procedure is technically simpler and usually shorter in operation time. The second type is the classic gastric bypass operation called Roux-en-Y gastric bypass, or RYGB. This operation is more complex. A small stomach pouch is created, and part of the small intestine is bypassed, so food passes through a shorter digestive pathway. This operation usually leads to strong weight loss, and many patients lose around 25% to 40% of excess body weight within 1 to 2 years. However, because part of the intestine is bypassed, absorption of vitamins and minerals becomes lower. Patients may develop deficiencies in vitamin B12, iron, calcium, vitamin D, folic acid, and protein if supplements are not taken regularly. These deficiencies may later affect hair, skin, nails, muscles, nerves, and bone health. One well-known problem after the surgery is dumping syndrome. This happens when food, especially sugary food, moves too quickly into the intestine. The patient may suddenly feel dizziness, sweating, rapid heartbeat, abdominal cramps, nausea, or diarrhea after eating. The third type is mini gastric bypass, also called one-anastomosis gastric bypass, or OAGB. Today, this is considered one of the most commonly performed bariatric surgeries in many centers around the world. Its concept is similar to the classic gastric bypass, but technically is simpler and usually faster during surgery. Weight loss results are also very strong and close to those of the classic bypass. The operation works by creating a long, narrow stomach pouch connected to the intestine through a single connection instead of two. Possible complications are similar to other bypass surgeries, including vitamin deficiencies, reflux in some patients, and nutritional problems if supplements are ignored. The fourth type is gastric banding. In this procedure, an adjustable silicone band is placed around the upper part of the stomach. This creates a small upper pouch, making the patient feel full after eating a small amount of food. One advantage is that the band can be adjusted, tightened, loosened, or even removed. The operation itself is relatively simple. However, long-term weight loss results are generally weaker compared with newer bariatric procedures. The band may also slip, erode into the stomach wall, or cause pain, vomiting, or inflammation. Because of these complications and lower success rates, gastric banding is much less common today. The fifth type is a duodenal switch operation, sometimes called biliopancreatic diversion with duodenal switch. This is one of the strongest bariatric surgeries for weight loss. It combines sleeve gastrectomy with a major intestinal bypass. Because food absorption becomes significantly reduced, patients can lose a very large amount of weight, especially patients with extremely high BMI values. In some patients, excess weight loss may exceed 35%. However, this surgery is complex and carries a higher risk of nutritional deficiencies. Patients usually require lifelong follow-up with doctors and dietitians, along with continuous vitamin and mineral supplementation. Without proper follow-up, serious deficiencies in protein, vitamins, calcium, iron, and fat-soluble vitamins may occur. The sixth type is the intragastric balloon. In this procedure, a balloon filled with saline or gas is placed temporarily inside the stomach using an endoscope. The balloon occupies space inside the stomach, so the person feels full earlier and eats less food. Usually, the balloon remains for around 6 months. Then it is removed. One possible problem is balloon leakage or rupture. For this reason, many balloons contain colored liquid. So if leakage occurs, the patient may notice a color change in urine and seek medical help quickly. Another very common side effect is severe nausea and vomiting during the first days or weeks after insertion. Some patients tolerate it well, while others may request early removal because of discomfort. Another issue is that weight regain may occur after balloon removal if the patient does not permanently improve eating habits and lifestyle. So, these are the 6 most well-known bariatric procedures used around the world. As we discussed, one of the most popular operations today is the mini gastric bypass because it combines strong weight loss results with relatively simpler surgical technique. But always remember, the best operation is not the same for everyone. The final decision depends on many factors, including BMI, eating behavior, medical conditions, reflux symptoms, diabetes, age, nutritional status, and the surgeon's experience. That is why proper medical evaluation before surgery is extremely important. The second topic in today's episode is one of the most important topics that every pharmacist, healthcare worker, and even every bariatric surgery patient should understand very well. As a pharmacist, you should know the common complications after bariatric surgery, understand their symptoms, and know when the patient needs urgent medical attention. Today, we will discuss 11 important and very common complications that may happen after bariatric surgery, especially gastric bypass and sleeve gastrectomy procedures. The first complication is leakage. How does leakage happen? After the surgeon cuts or reshapes the stomach, the stomach is closed using surgical staples and sutures. This staple line needs time to heal properly and seal completely. Sometimes, for different reasons, a small opening may occur in this area. As a result, stomach fluid and digestive contents start leaking outside the stomach into the abdominal cavity, causing severe inflammation and infection. This complication may happen because healing is weak, blood supply to the tissue is poor, excessive pressure develops inside the stomach, or the patient starts eating incorrectly very early after surgery. Leakage usually appears within the first few days after surgery, but in some cases it may appear after 1 or 2 weeks. What symptoms may suggest a leak? The first symptom is fever or elevated body temperature. The second symptom is a rapid heartbeat, even while resting. The third symptom is persistent nausea and repeated vomiting, not only after eating. The fourth symptom is severe abdominal pain, swelling, or bloating. Some patients also develop shortness of breath or difficulty breathing because inflammation inside the abdomen may affect the diaphragm and lungs. These symptoms are dangerous and require immediate medical attention. The doctor will usually order a CT scan with contrast to identify the exact location and severity of the leak. If the leak is small and discovered early, treatment may include strong antibiotics, stopping oral food temporarily, intravenous fluids, and nutritional support through special feeding methods until healing occurs naturally. However, if the leak is large or severe, the patient may require another procedure or surgery to repair the leakage and drain infected fluid. The second complication is bleeding. Bleeding may occur during surgery or shortly after surgery. Sometimes it happens because of incomplete blood vessel sealing during the operation. In other cases, blood-thinning medications, herbal supplements, or clotting disorders may increase the risk. That is why every patient should inform the surgeon about all medications, vitamins, herbs, or supplements before surgery. Certain medications, such as aspirin, anticoagulants, and some herbal products, may need to be stopped before the operation under medical supervision. Patients should never stop important medications on their own without consulting the doctor. The third complication is blood clots, especially deep vein thrombosis or DVT. This means a clot forms inside the deep veins, usually in the legs. Why does this happen? Many bariatric patients already have obesity-related poor circulation and reduced physical activity before surgery. After surgery, movement also becomes limited temporarily. All these factors increase the risk of clot formation. This is why doctors focus strongly on preventing clots after surgery. Usually, 2 important preventive steps are taken. First, the patient may receive blood-thinning injections for a short period after surgery. Second, the patient is encouraged to start moving and walking as early as possible, even if movement is simple and gradual. Some patients may also wear compression stockings or pneumatic compression devices to improve blood circulation in the legs. This complication is serious because a clot may travel to lungs and cause pulmonary embolism, which can become life-threatening. The fourth complication is nausea and vomiting. This is extremely common during the first weeks after surgery. The stomach becomes much smaller, and patients are unable to tolerate large meals. In many cases, vomiting happens because the patient eats too quickly, swallows large bites, or drinks fluids rapidly during meals. Fortunately, this problem usually improves gradually over time. To reduce nausea and vomiting, meals should be divided into very small portions eaten several times throughout the day. Food should be chewed slowly and carefully, and patients should avoid overeating. The fifth complication is acid reflux or severe acidity. Some patients develop strong reflux symptoms after bariatric surgery, especially after sleeve gastrectomy. Why does this happen? Because the stomach shape and pressure change after surgery, acid may move upward more easily into the esophagus. This may cause heartburn, chest burning, throat irritation, sour taste in the mouth, or chronic cough. For this reason, doctors often prescribe medications from the proton pump inhibitor group called PPIs, especially during the first months after surgery. Examples include omeprazole and pantoprazole. These medications reduce stomach acid and protect the surgical area during healing. However, PPIs should not be used unnecessarily for very long periods without medical follow-up. Long-term excessive use may reduce the absorption of nutrients such as magnesium, calcium, iron, and vitamin B12. This is important because bariatric patients are already at risk of nutritional deficiencies. Therefore, PPI should always be used at the lowest effective dose and for the appropriate duration recommended by the doctor. The sixth complication is weight regain after surgery. Many people think bariatric surgery is a permanent magic solution. In reality, surgery is only a tool. Studies show that some patients regain part of the lost weight several years later, especially if healthy habits are not maintained. Why does this happen? Over time, the stomach may stretch gradually. In addition, unhealthy eating habits, lack of exercise, emotional eating, high-calorie liquids, sugary drinks, and poor sleep all contribute to weight regain. This is why long-term success depends heavily on lifestyle changes. Patients must follow healthy eating habits, regular exercise, adequate hydration, sufficient protein intake, and lifelong medical follow-up. The seventh complication is dumping syndrome, which is one of the most famous complications after gastric bypass surgery. This usually happens after eating foods or drinks containing large amounts of simple sugar. After bypass surgery, food may move too quickly from the stomach into the intestine. Sugary food then enters the bloodstream rapidly, causing sudden symptoms. The patient may experience rapid heartbeat, sweating, dizziness, nausea, abdominal cramps, weakness, shakiness, or severe fatigue immediately after eating. Some patients feel as if they may faint. What is the solution? Patients should avoid concentrated sugary drinks, desserts, and excessive simple sugars. Instead, meals should contain protein, fiber, and complex carbohydrates. Food should not consist only of liquids or sweet juices. Fiber and protein help slow sugar absorption and reduce sudden blood sugar changes. The eighth complication is intestinal obstruction or bowel blockage. This complication may happen months or even years after surgery. How does it occur? Sometimes scar tissue or internal adhesions form after surgery. In other cases, parts of the intestine may twist or become trapped internally. As a result, the intestine becomes partially or completely blocked. Symptoms may include severe abdominal pain, repeated vomiting, inability to pass gas or stool, abdominal swelling, nausea, and rapid heartbeat. This condition is dangerous and requires urgent medical evaluation. A CT scan is usually needed to determine the cause and location of the obstruction. The ninth complication is chronic diarrhea and foul-smelling stool. Why does this happen? After some bariatric procedures, especially bypass surgeries, fat absorption becomes lower than normal. Undigested food may also reach the colon in larger amounts. Bacteria inside the intestine ferment as food, producing gas, bloating, diarrhea, and unpleasant stool odor. Treatment usually includes several steps. First, the nutrition plan should be adjusted carefully with a doctor or dietitian. Fat intake may need reduction, while fiber intake may need improvement. Second, digestive enzyme support may help some patients. Third, Probiotics may sometimes be prescribed temporarily to improve intestinal bacterial balance. The 10th complication is muscle weakness and muscle loss. Rapid weight loss does not only burn fat. Unfortunately, the body may also break down muscle tissue if nutrition is poor. This is why preserving muscle mass after bariatric surgery is extremely important. There are 3 essential steps. The first step is adequate protein intake. Patients should consume enough high-quality protein, such as fish, eggs, chicken, dairy products, or protein supplements if regular food intake is insufficient. In many cases, bariatric patients need approximately protein/intake/approximate 1.0-1.5/g/kg/day. The exact amount varies depending on medical condition, activity level, and doctor recommendations. The second step is maintaining proper vitamin and mineral levels, especially vitamin D, calcium, magnesium, iron, and vitamin B12. The third step is regular physical activity. Patients do not need intense exercise immediately after surgery. However, regular walking and gradual resistance exercises help preserve muscle mass and encourage the body to burn fat instead of muscle. Muscle loss is not a minor problem. Severe muscle wasting may lead to weakness, fatigue, lower back pain, poor balance, and reduced physical function. The 11th and final complication is loose skin and skin deformity after major weight loss. Why does this happen? When someone remains overweight for many years, the skin stretches significantly. Over time, collagen and elastin fibers inside the skin become weaker. After rapid weight loss, the skin may not shrink completely back to normal size. Loose skin commonly appears in the abdomen, arms, thighs, chest, neck, and face. Unfortunately, there is no magical solution that completely prevents loose skin after massive weight loss. However, several measures may improve skin quality and reduce severity. The first step is proper hydration. Adequate water intake is important for skin health and general body function. The second step is maintaining good nutrition, vitamins, minerals, and sufficient protein intake. The third step is exercise and muscle strengthening, which may improve body shape underneath the skin. Some doctors also recommend collagen support and vitamin C because vitamin C helps natural collagen formation. However, when excess skin becomes severe, surgical procedures may become the most effective solution. For abdominal loose skin, surgeons may perform abdominoplasty, also known as a tummy tuck. For the arms, a procedure called brachioplasty may be performed. For the thighs, a thigh lift may help remove excess skin. For facial laxity, non-surgical procedures, such as laser therapy, microneedling, ultrasound therapy, or radiofrequency treatments may improve skin texture and firmness in mild cases. But if facial sagging becomes severe, surgical lifting procedures may sometimes be necessary. So, these are the 11 most important and most common complications after bariatric surgery. Always remember, bariatric surgery can completely change a patient's life for the better, but success does not depend on surgery alone. Long-term success requires medical follow-up, proper nutrition, physical activity, vitamin supplementation, and permanent lifestyle changes. The third and final topic today is one of the most important parts after bariatric surgery. Supplements, vitamins, minerals, the correct doses, and the best forms to use. Please understand something very important. After bariatric surgery, supplements are not optional. They are not just extra vitamins. For bariatric patients, supplements become an essential part of treatment and long-term health. Why? Because after surgery such as gastric bypass or sleeve gastrectomy, the body may absorb nutrients less efficiently, and food intake becomes much smaller. As a result, patients may develop many problems if vitamins and minerals are not replaced properly. These problems may include hair loss, weak nails, dry skin, fatigue and exhaustion, dizziness and weakness, iron deficiency anemia, bone weakness, muscle weakness, mood changes and psychological stress, vitamin deficiencies, and nutritional problems. This is why regular follow-up, blood tests, healthy eating, hydration, movement, and proper supplements are all extremely important after surgery. Now, let us discuss the most important supplements commonly recommended after bariatric surgery. The first supplement is multivitamins. Usually, doctors prescribe a complete bariatric multivitamin daily. Why? Because bariatric patients may develop multiple vitamin and mineral deficiencies at the same time. The multivitamin helps provide general daily nutritional support and reduce the risk of deficiencies. However, keep in mind, the amounts inside regular multivitamins are usually maintenance doses only, often close to the recommended daily allowance, or RDA. They may not be enough if the patient already has a severe deficiency. That is why regular blood tests are very important. If laboratory tests show a deficiency in a specific nutrient, the doctor may prescribe additional separate treatment at higher doses. What is the best way to take multivitamins? Usually, they are better absorbed when taken with food, unless the doctor gives different instructions. The second very important supplement is vitamin B12. Vitamin B12 deficiency is extremely common after bariatric surgery, especially gastric bypass. Why? Because vitamin B12 absorption depends partly on stomach acid, an intrinsic factor produced by the stomach. After surgery, this process becomes weaker. Vitamin B12 deficiency may cause fatigue, anemia, numbness, memory problems, nerve damage, and weakness. Vitamin B12 can be taken in several forms: tablets under the tongue, oral supplements, or injections. Common maintenance doses are approximately vitamin B12 approximate 500-1000 mg/day. Some patients may instead use weekly or monthly injections depending on blood test results and medical evaluation. The exact dose always depends on laboratory tests and doctor recommendations. The third important supplements are calcium and vitamin D. These two are usually taken together because vitamin D helps calcium absorption. After bariatric surgery, bone health becomes extremely important. Without proper supplementation, patients may develop weak bones, osteoporosis, muscle cramps, or bone pain. The preferred calcium form for many bariatric patients is calcium citrate because it is absorbed better, especially when stomach acid is reduced. Common daily calcium needs after bariatric surgery are usually around calcium approximate 1200-1500 mg/day. As for vitamin D, the dose depends completely on blood levels. If vitamin D levels are normal, many patients use maintenance doses between 1,000 and 2,000 IU daily. If there is severe deficiency, doctors may prescribe higher doses temporarily, such as 50,000 IU weekly for a limited period, followed by maintenance therapy later. The next very important supplement is iron. Iron deficiency anemia is one of the most common complications after bariatric surgery. Patients may develop fatigue, dizziness, weakness, hair loss, pale skin, shortness of breath, and poor concentration. The most commonly used forms include ferrous fumarate, ferrous sulfate, or liposomal iron. Liposomal iron may cause fewer stomach side effects in some patients. Most bariatric patients need approximately elemental iron approximate 18-45 mg/day. But here there is a very important point. When reading iron supplements, do not focus only on the total tablet weight. Focus on the amount of elemental iron, which means the actual usable iron inside the product. For example, iron salts contain different percentages of elemental iron. Another important point: iron should not be taken at the same time as calcium because calcium reduces iron absorption. It is better to separate them by approximately 2 to 4 hours. The next important supplement is zinc. Zinc is important for immunity, wound healing, skin health, and hair growth. Many bariatric patients may need approximately 8 to 15 milligrams daily, depending on diet and blood test results. Next comes collagen and biotin. These supplements are commonly used to support skin, hair, and nail health after major weight loss. Biotin is often used in doses ranging from 500 to 10,000 micrograms daily. Collagen supplements, especially marine collagen, are also commonly used by many patients. Vitamin C may help natural collagen formation in the body as well. These supplements may help improve skin appearance and reduce some hair problems after surgery, although they are not magical solutions. The final and one of the most important nutritional elements is protein. protein is essential after bariatric surgery. Why? Because rapid weight loss may cause the body to lose muscle mass in addition to fat. Adequate protein helps maintain muscles, improve healing, support immunity, and reduce weakness. Patients should try to get protein mainly from healthy foods such as fish, chicken, eggs, low-fat dairy products, lean meat. If food intake is insufficient, protein powders may also be used. Usually, low-fat, high-quality protein supplements are preferred. In many bariatric patients, protein needs are approximately protein/approximate 1.0-1.5/g/kg/day. Finally, always remember, bariatric surgery is not only an operation, it is a lifelong commitment. The surgery itself may last only a few hours, but maintaining health afterward requires permanent lifestyle changes, regular follow-up, healthy eating, blood tests, movement, hydration, and correct supplementation. And most importantly, never take supplements randomly after bariatric surgery. Always follow your doctor, pharmacist, or dietitian, and regularly monitor laboratory tests to adjust doses safely and correctly. The fourth and final topic in today's episode is, what are the follow-up steps and medical tests that every bariatric surgery patient should do regularly? This topic is extremely important because proper follow-up helps doctors discover any nutritional deficiency or complication early, before serious problems appear. After bariatric surgery, the patient may look healthy and feel fine, but hidden vitamin or mineral deficiencies can still develop slowly over time. That is why regular laboratory tests are considered one of the most important parts of long-term care after surgery. Let's go step by step. The first major follow-up usually begins about 3 months after surgery. At this stage, the doctor starts requesting several important laboratory tests. The first test is a complete blood count, or CBC. Why is this important? Because it helps detect anemia, iron deficiency, infection, inflammation, or problems related to blood cells. At the same time, doctors usually request iron studies to evaluate iron stores inside the body more accurately. Vitamin B12 and vitamin D levels are also checked because deficiencies in these vitamins are extremely common after bariatric surgery. In addition, doctors may evaluate zinc levels, albumin levels, and kidney function tests such as creatinine. Albumin is important because it gives an idea about nutritional status and protein intake. One of the most important tests during this period is blood sugar evaluation. This includes fasting blood glucose and HbA1c. Why is this so important? Because after significant weight loss, especially during the first few months, blood sugar levels often improve dramatically, particularly in patients with type 2 diabetes. Some patients may even need lower doses of diabetes medications very quickly after surgery. In certain cases, some medications may need adjustment or discontinuation under medical supervision. However, this decision must always be made by the treating physician based on laboratory results and the patient's condition. Blood sugar improvement is often one of the earliest and fastest positive results after bariatric surgery, especially in patients with type 2 diabetes. The second major follow-up usually happens after 6 months. At this stage, many of the previous tests are repeated again. However, doctors may also begin evaluating liver and kidney function more carefully. This includes tests such as ALT and AST for liver function. Why? Because incorrect supplement use, dehydration, excessive medications, or poor nutrition may sometimes affect the liver or kidneys. Some patients mistakenly think that taking very high doses of vitamins without supervision is always beneficial. In reality, excessive supplementation may sometimes harm the body instead of helping it. That is why supplements should always be taken according to medical recommendations and laboratory monitoring. If laboratory results remain stable and normal, the patient usually continues the same follow-up plan. After approximately 1 year, many of the same blood tests are repeated again. At this stage, doctors often begin evaluating cholesterol levels and lipid profile more carefully. Why? Because cholesterol and triglyceride levels often improve significantly after weight loss surgery. Unlike blood sugar, which may improve within weeks or months. Cholesterol improvement may take longer to appear clearly. If cholesterol levels improve greatly, the doctor may decide to reduce or stop certain cholesterol medications if the patient was using them previously. In some cases, doctors may also recommend omega-3 supplementation to help support healthy lipid balance and increase beneficial HDL cholesterol. However, starting supplements or stopping medications should always happen under medical supervision after reviewing laboratory tests. After around 2 years, long-term follow-up becomes even more important. At this stage, many routine blood tests continue as usual, but one additional test becomes especially important: bone density measurement. This test is commonly called a DXA scan or DEXA scan. Why is bone density monitoring important after bariatric surgery? Because long-term deficiencies in calcium, vitamin D, protein, and other nutrients may gradually weaken bones over time. Rapid weight loss, low muscle mass, poor nutrition, and vitamin deficiencies may all contribute to reduced bone strength. That is why doctors often monitor bone density regularly in patients at higher risk. The DXA scan is usually done together with blood tests for calcium, vitamin D, and sometimes parathyroid hormone levels to assess bone health more accurately. Now, an important question. If all tests remain normal after the first 1 or 2 years, does the patient still need frequent testing every few months? Usually, no. If the patient is stable, healthy, following the diet correctly, and laboratory results remain normal, follow-up intervals may become less frequent. Some patients may only need testing every 6 months or once yearly, depending on their medical condition and doctor recommendations. However, if symptoms appear at any time, testing may need to be repeated earlier. The final and most important advice before ending today's episode is this: anyone who undergoes bariatric surgery must understand that vitamin and mineral deficiencies can develop silently over time. Do not wait until symptoms become severe. Sometimes deficiencies cause no obvious symptoms in the beginning, and sometimes excess supplementation can also become harmful. That is why laboratory tests are more reliable than depending only on how the patient feels. The decision to continue, stop, increase, or reduce supplements should always be based on medical follow-up and laboratory results. Always follow your doctor, dietitian, and pharmacist regularly. Proper nutrition, hydration, exercise, supplements, and regular testing are the real keys to long-term success after bariatric surgery. And with this, today's episode comes to an end. I hope I was able to provide useful, simple, and practical information that can truly help patients and healthcare workers better understand bariatric surgery and long-term follow-up. Finally, if you enjoyed the video and found the content helpful, do not forget to like, subscribe, and share the episode. And if you'd like to support the channel, you can also support us through Patreon, PayPal, or YouTube support options. May God bless you all.